Happy Thursday. This is the Coffee and Coaches Conference call. I have Neuro Coffee in hand, and it is perfect. Okay,
Curious about your thoughts on it.
sure.
Speed breeds efficiency.
Speed breeds efficiency.
Yes.
Okay. What, this is in reference to what?
Pitching mechanics and arm speed.
I mean, I understand what they're probably trying to get at, you know?
I do, but knowing what I know now, I'm having a hard time accepting that.
Well, I think let's reverse it. I think that would be a much more profound statement, is that efficiency breeds speed.
That's exactly.
I don't think it goes the other way. I don't think that doing something faster necessarily produces the desired outcome. I think that if you, when you think about just the sequence of events that has to occur to produce a major league fastball, if there's not an element of efficiency in that, I don't know how it even remotely occurs in some form of control.
I agree 100%.
I was just thinking about like the importance of sleep. We definitely talk about the importance of sleep for athletes and people who are on weight loss. But have you experienced patients or clients recovering in rehab to do better with sleep or less sleep, or is that something you even talk to about?
So it comes up every once in a while. This sounds like such a cheesy statement. Have you read my book? So the whole section in my book about this. I'm not a sleep expert, so I tend to not get too deep about it. But like I said, it does come up on occasion. I'm more about the execution of the things that I have to have them do in the acute, element within the appointment as being my priority. But obviously it's important. Just from a stress response standpoint, actually I had somebody come in yesterday. We did mention it. And so we'll talk about it a little bit, from a recovery standpoint with our athletes and such that might be dealing with some stuff. Every time I do a mentorship call, I talk about it at like every call, because I want everybody that when you're trying to be productive, energy is everything, right? And so sleep is sort of like this foundational thing that if you don't get enough, then everything gets worse. And I think that you just try to get the big rocks under most circumstances.
Right.
It's like make sure that people hit like a sleep time, wake time kind of thing is probably one of the biggest, just the regularity of sleep. So if anything, I might emphasize that.
No, but we do talk about, the importance of sleep, especially with the group of people who are losing weight. Like that's one of the big rocks we focus on, especially if they're feeling frustrated that they're not losing weight. And we kind of like look back at their stress management and kind of go into like, how are they sleeping? Are they getting enough sleep? But I just didn't know if you're seeing people who are like are in pain, and if they're getting adequate sleep, do they actually go through you a little bit faster than people who are going to gain less sleep? And like how would sleep impact your side of the spectrum?
Well, so here's how it impacts everything. So and we can talk about your context as well. So think about the behaviors that you're trying to influence. Like you're trying to get people to actually change the way that they behave, right? And so that requires a little bit of output from your brain because you're making decisions all day long, right? So if you put a piece of chocolate chip cheesecake down in front of somebody that's restricting their food intake, right? That takes energy to say, I'm not going to eat that, right? And so the foundation then, do I even have the energy to make that decision? Because every decision that you make during the day, even the smallest ones, requires energy. And have you heard about concepts like decision fatigue and things like that?
Yeah.
Like is it David Rock, I think, has the book Your Brain at Work or something like that, where he talks about that type of a concept. It's like, so you got to appreciate that. And so if they're starting from a deficit, if you're trying to lose weight and you don't have like some other factor that's going to influence your behavior favorably, right, towards the goal, you're going to be in trouble. So I think, from your standpoint, obviously it's very, very impactful. It is impactful from my standpoint because pain is a decision. It's just a decision that they don't make consciously, right? And so if they are defensive, so a lot of people will come to me and their physical behavior, their motor output is a defensive behavior. And if they don't have enough energy, then they're going to default to the easiest thing, which is, the negative. Everybody defaults towards the negative. It's one of our little protective elements that we're born with, right? So if you're dealing with a painful situation, and I don't have enough energy, and I default to the closest thing, yeah, they're gonna feel crappier.
Because I know you talk about baseball pitching and stuff, because I know throwing pitching mechanics, there's definitely some similarities there with serves. So I guess I was just curious if that's something you work with ever, frequently, and kind of how that relates.
I don't know if I've seen a tennis player. Well, I have one that she's a little bit older, but I mean, I've seen my fair share, if you will. And again, while there's some obvious differences, the strategies are the same. Whether we're talking, I mean, anytime that you're producing force into an implement, and especially the fact that we just use our ability to turn to produce that force, there's going to be similarities, right? As far as how that force is produced and when that force is produced, right? And so, anytime you have an implement like a tennis racket or a golf club, the mechanics will be a little bit different, but the concepts will be the same, right? As to how we and again, it's very, very deceptive as to what people think is happening versus what actually happens, because we see the visual, right? Where everybody sees the velocity, right? When you see a racket, that's not, when you see the racket moving quickly, it's like, that's not where the maximum force is. The maximum force took place right before that allowed that racket to move quickly. And this makes it very deceptive as to how you need to train this person to produce those forces. So I think there's a little bit of confusion there.
Could you go over the iterations in the pelvis? So you said, for instance, the first one was the compression in the dorsal-rostral area, typically, to push their center of gravity forward.
Correct.
Would the iteration for that in the pelvis be above the trochanter?
Yeah, so let me just grab the pelvis. How about that? So if you think about a wide presentation where they're going to be mutated, right? And try to get this posterior lower expansion, right? Okay. Which means that I'm going to get shoved in that direction, right? You look at the pelvic axis, so as the gut volume would come down and it goes that way, right? It's going to make me go like, so it's going to tilt me like that, and then I want to propel forward, right? And so, I'm sorry, it's going to push me backwards, and this is going to push me forward, right? So this would be the equivalent to my dorsal rostral.
So that will typically give you an anterior orientation of the pelvis.
Right. So again, so this is me going backwards, right? This would be like what most folks will call a hinge, right? If I exaggerate that. And so again, I don't want to fall backwards. So I need something to push me forward. And so I have to do that.
Gotcha.
Yeah. And then the sequence basically looks the same, right? So if I have something that's pushing me forward, eventually I'm going to need something that pushes me back.
So what would that be? The first one would be like adductor longus and brevis.
Yeah. Right there.
Okay.
They attach right there. Yeah. And they would push this back. And again, it's like the naming of these things is what creates a lot of the confusion. Because if I tell you that glute max is one muscle, you immediately create this representation in your head of how it should behave. If I told you that actually glute max is 5 different muscles instead of being one, now you got to figure out, like, okay, wait a minute, if it's 5 muscles, then how does it behave differently?
Yeah.
Right? And that's the perspective that you have to have when you're looking at the anatomy, because again, the guys that did the first dissections got to name all this stuff. And so it was their perspective that we are unfortunately still using, which creates a lot of confusion for us as far as how things do behave, because people look at glute max as a single muscle. It's not. It's many muscles, right? External oblique, you now know, is more than one muscle, right? But again, so this is literally how things move. So when I'm superficial and expanded, I can move really fast in one direction, and then I have to create this compressive strategy. So we have an expansive strategy and compressive strategy. And the compressive strategy reverses gears and turns it in the other direction. If you take a step forward and you land on your right foot, same thing is happening. As you position your leg, the volume is spiraling around the outside. As you land and you have to push, it spirals up and in through the middle of the leg as you propel. So this is the difference between when you're walking, the difference between when your foot's off the ground and when your foot's on the ground. When your foot's off the ground, it's expansive, and this superficial volume is circulating around the extremity. As you land and everything has to squeeze and compress, now you're twisting that towel tighter because you have this storage of energy, and it goes up and through the inside.